Welcome, students. We're going to get started today with our slides. We are continuing on with our Chapter 8 PowerPoint on pharmacology and pharmacy. Today, we're going to be covering slides 64 to 80. So, we're going to be covering a few different subjects about drugs affecting different bodily systems. So, we're going to look at the cardiovascular system today. We'll look at the endocrine system. We'll look at the reproductive system. And so forth for the lecture for this evening. So, with that being said, let's get started with the cardiovascular system first. So, with this body system, I am mostly talking about the heart, the lungs, and the veins and arteries and the blood within them. That is what I'm referring to when I'm speaking about the cardiovascular system. Now, I'm going to break this down into different classes of drugs that we can use for this specific system. And please be aware that some of these drugs that are listed have multiple uses. So they might be listed here, they might be in other parts of the PowerPoint as well. And again, they can be a medication that can have one effect in one animal and a different effect in a different one. That's what makes it kind of complex when we're here talking about animal medicine and medicine to use in animals and what animals. I digress. The first topic we're going to look at for drugs affecting the cardiovascular system is anti-arrhythmic drugs. So, an arrhythmia, what is an arrhythmia? An arrhythmia is it's a blanketed term basically saying that there is something wrong with the heart rhythm. An arrhythmia, that could be too fast of a heart rate, that could be too slow of a heart rate, that could be a murmur, blood swishing around in the heart, ventricles not closing all the way. It could be skipping of beats. It could be where the ventricles are rapidly firing, VFib. It can be any of those things. Again, an arrhythmia is just a blanketed term for some type of electrical beat malfunction in the heart. So, again, or abnormal electric activity pattern in the heart. So, for example, tachycardia. That stands for too fast of heart rate. Tachy means to go quickly. Bradycardia is the alternate of that term. Brady is to go slowly, so slower than normal heart rate. Again, the desired effect, if it's tachycardia, if it's too fast, I need to bring that back down. I need to slow the heart rate again. If it's bradycardia and it's too slow, I need to speed it back up. So I'm going to use whatever drug is going to be for that desired purpose based off of the arrhythmia that's present. So I could use medications like lidocaine, Mexaltine, quinidine, procanamide. Those are all medications that help decrease the rate of sodium movement to the heart cells. So that can help slow down the heart rate. Propranolol or Inderol is a beta blocker. This will also cause the heart to contract with less force, which also decreases the heart rate. Propranolol is it's a medication that they can be on a daily basis if they have high blood pressure or if they suffer from things like congestive heart failure, where the heart pattern might be faster than normal. High heart rate and high blood pressure go hand in hand. When the vessels are constricted and they're tight, the blood is pumping faster, the body is operating faster. Versus if they're decreased, they're dilated, they're going to be slower. We can also use calcium channel blockers for this effect as well. Some more medications when we're talking about the cardiovascular system. The next subject we're looking at here is positive inotropic agents. So we were just looking at medications to help um, decrease the heart rate. But when it comes to medication to increase the heart rate, we could be looking at inotropic agents or inodilators. So a positive inotropic agent, this is a medication like digoxin. It can help increase the strength of a contraction of the weakened heart. So it can help get that strength back, get that good contraction time back to get a stronger beat and a stronger flow. Now, I want to bring this up because there's a lot of medications that when people see them on the screen, they see them written out, they immediately have a fear response to them because they associate them with usually things like death. Digoxin is one of those medications. If you are a crime junkie like I am, and if you have ever watched any of those killer nurses or killer doctor documentaries, they have a really good killer nurse one on Netflix. I can't exactly remember the name of it. I just know that if you look up like killer nurse, you'll probably find it. And it was a nurse that was going around and medicating and overdosing patients on digoxin, causing them to have heart attacks. I mean, just killing quite a few people before they ever got caught. And it's one of those medications that now when I see it, I'm almost like, oh gosh, man, that was a really scary medication when it was used in that way. I want to remind you that it's all about the therapeutic index. It's all about that therapeutic range. How are we dosing them and are we dosing them appropriately? When digoxin is dosed appropriately in that therapeutic range, the patients don't die, right? It's dosed appropriately, it's dosed for a good amount to be effective, but not so much that it will kill them, hence therapeutic range. But you could really look at any medication and it can fall into this category. Insulin can absolutely kill an animal. This is why we stress so much about knowing the difference between cc's and insulin units and using the correct syringes. We'll look at insulin a little bit later. But that's just another example of a medication that, again, one that you wouldn't think even but with the wrong dose can absolutely be fatal. Another one is fentanyl. People think of fentanyl and they get very scared, and reasonably so. It can be a very scary drug at inappropriate concentrations. We use fentanyl all the time in the veterinary field, especially for pain relief after a traumatic or extreme injury or illness. Um, it's a great narcotic pain relief medication, but if not dosed properly, you can overdose and die. And we're seeing a really big epidemic. It's a problem in the United States right now, really big problem. But is it a drug to be afraid of? No. Is digoxin a drug to be afraid of, although it killed a lot of people? No, you shouldn't be afraid of it. Because again, we're in a medical setting here. We're using it appropriately. We're using it for medical purpose. That's why you're learning medical math, is so that you know how to dose it appropriately and we don't kill animals. The whole point is to help them feel better. So I just wanted to have that small excerpt in there because I'm going to start to list off names of medications, and some may be familiar to you. Now, another class of cardiovascular system drugs are enodilators, and again, dilation. So, when we're talking about vasodilation, vaso being blood vessels, dilation meaning to get larger, have more room. When blood vessels are constricted, they're really tight, the blood doesn't have a whole lot to move through, right? So, the blood pressure just skyrockets. When those same vessels dilate, now there's all this room for the blood to flow through. It's going to now lower that, it's going to dilate and lower that blood pressure. Also, lowering the heart rate usually as well. Now, an enodilator can be used for a lot of different things. Again, for inotropic or vasodilator effects, we use it commonly in congestive heart failure patients, patients that have dilated cardiomyopathy, chronic mitral valve insufficiency. It's kind of a medication that can help treat a lot of different conditions within the cardiovascular system. So let's talk a little bit more about what a vasodilator is and the drugs that fall under that category. So a vasodilator, again, this is a medication that's going to dilate the vessels in the body. So it's going to lower blood pressure. Most of the time, if it's given a medication like on a daily basis, it's going to be trying to lower that blood pressure. High blood pressure is much more common than low blood pressure. On a daily management type basis. So a vasodilator will cause the anteriolar smooth muscle to relax. So the arteries, they are responsible for pumping blood through the body at a very high pressure. They're the pulse points in the body. When we're measuring blood pressure, we're measuring the pressure of those arteries. We're not looking at the veins. The veins are not high pressure vessels. Now, Vasodilators are going to benefit poorly functioning mitral valves, which help with our pulmonary circulation, which is reoxygenating of those blood cells before they get pumped out into systemic circulation across the entire rest of the body to perfuse into those tissues. Now, hydralazine is a medication that we use to help more blood flow to get to the aorta, which is the biggest vessel that you're going to find in the body next to the vena cava, and help have less flow back into that left atrium. So keeping the blood in the direction that it needs to go in. Another medication that's a vasodilator is nitroglycerin. This will help relax venous blood vessels. It comes in a few different applications, such as creams or patches. So that can be great for pets that might not take medications very well. We also have transdermal medications, which is like a cream that you can put on the inside of the ear. Nitroprusside is another medication that's a vasodilator. It's similar to nitroglycerin, again, helping monitoring lower down that blood pressure. We can also use angiotensin converting enzymes or ACE inhibitors, balanced vasodilators. There's a lot of options that we have for that. I want to remind you, as we're talking about these different medications and what they do, you should be focusing on just that. What are these medications? What part of the body are they for? And what is the purpose? What do they do? I don't want you to focus on like, why would one pet need that one medication and another would need another, but it's the same class of drug. The doctor is the one that decides that. Remember, the doctors go to school for 8+ years to get their doctorate in veterinary medicine, and they have to pass very high stakes board examinations. They go through all of that to be able to diagnose and prescribe medication. So they're the ones that have to do all that math and all of that calculating and figuring out. As an assistant, your job is going to be educating clients on these medications, showing them how to give these medications to their animals. And again, if a client has a question about it, what type of medication is this? What is it going to do for my pet? You should be able to answer those questions. Now, if they were to ask you, why are we doing, furosemide or over spirulactone, that would be a question for the doctor. They're going to explain why they chose one medication over the other, and that could just be professional preference. So keep that in mind as we're going through these. Focus on the medication, what body system it's used for, and what it does. And this is something that over time it's going to become easier. You're going to see these medications being used in practice. You're going to get used to seeing what type of patient gets prescribed what kind of medication and why. It's something that over the next few years of your start in this career, this will become more familiar to you. It's definitely a harder subject at first because it's a lot of information right out the gate. But again, just take some time. So just be aware of that. So let's start to go through this next slide here. So more medications for the cardiovascular system. The next class of medications we're looking at here is diuretics. Diuretics will help increase urine formation and promote water loss. So it helps water move through the body and be released through urine. In patients who have congestive heart failure, this is common in older dogs, especially smaller dog breeds. When they have congestive heart failure, they will accumulate a lot more fluid than normal. Their antidiuretic hormone in their body it absolutely can have malfunction to where it's not producing properly, and all of a sudden they're retaining a lot more fluid. They can retain fluid in their chest. This is within their thoracic cavity. And with congestive heart failure dogs, we tend to do thoracentesis as a treatment. That's when we take a needle and syringe and we drain off the fluid in their chest. And then we would follow that with a medication like furosemide, also known as Lasix. This is a loop diuretic. So that means that it inhibits sodium, which is salt, reabsorption from the loop of Henle. So it's going to help stop sodium reabsorption to stop clinging on to so much water. The more sodium that an animal ingests, the more water it's going to hold on to. which isn't always a bad thing, but if you have a patient that has congestive heart failure, who's already has an issue with moving their fluids throughout their body, the last thing we want to do is add more fluid to that. So furosemide is a great one. Another diuretic is spirulactone. This is a great diuretic. I think it's favorable over furosemide. However, a lot of more doctors furosemide is definitely the more picked medication, but I really like spirulactone for this reason only. It's a potassium sparing diuretic. So diuretics, they help move fluid out of the body, but they also remove electrolytes in the process. So, electrolytes, we are talking about sodium, magnesium, potassium, um, just to name a few minerals that are included, vitamins and minerals that are included within electrolytes. So, spirulactone, it will still move the water out of the body, help with being a diuretic. It will still strip some electrolytes, but it'll spare the potassium left in the body, which can be a benefit. Um, it's also a competitive antagonist of aldosterone, so it can help in certain hormone production as well. Another diuretic is mannitol. You may have heard of mannitol, especially if you have ever suffered from a brain injury or know somebody that suffered from a brain or some type of head injury. Mannitol is kind of the go-to diuretic for any type of neurological swelling. So, for example, hydrocephalus would be the correct term there. That just means water within the brain. So, a lot of swelling liquid inflammation that is in the neurological cavity. So mannitol is used a lot in that trade of medicine, but it's still a diuretic and could be used for other purposes too. It's considered to be an osmotic diuretic, which retains water in the tubular lumen. Okay, now we're going to be switching to looking at drugs that affect the respiratory system. So I am talking about the lungs here, specifically the mouth, the trachea, which attaches the mouth down to those lungs, and all the way up through the nasal passages as well. So with the respiratory system, we're going to look at the first class of drugs here are antitussives. These are medications that block the cough reflex. So have you ever felt that like tingling in your throat that you really got a cough, you can feel it. Um, I don't know if you've ever felt this feeling, but like if you're when I can think back to like when I was in grade school and like feeling that tickling in your throat and you're like, "Oh, I got a cough," and you don't want to cough, it's embarrassing and your eyes start watering. You're like, "Oh my gosh," just you have that cough reflex, right? You're trying really hard to not cough. Um so antitussives give that relief. But it depends on what kind of cough this animal has. So there's two different types of cough. There's productive cough and there's non-productive cough. And depending on the type of cough that they're experiencing will determine the type of medication we use to treat it. So let's talk about it. A productive cough, that means that it produces something. I think of productive like produces, so it produces mucus. If they cough, they're going to be coughing up mucus, like you can hear they're congested with that in their chest. Now, a non-productive cough is kind of where you feel that tingling, it's that dry, hacking, won't go away. And sometimes it's just really annoying, really persistent over and over and over. There ain't nothing that's producing or coming up. It's just dry coughing. So, an antitussive, a medication that blocks the coughing reflex, is ideal for non-productive cough, right? If it's dry, a hacking cough, they don't need to be coughing. We can help block that reflex so they stop coughing so much. Versus if it's a productive cough and it produces mucus, we want them to cough. We want them to cough up that mucus. So we would not want to give an antitussive to a productive cough. And we'll talk about that in the next slide, what I would give instead. Um, More antitussives are going to be butorphanol, which is also known as Torbidol or Torb. Codeine, we do use codeine in animals. It's also used in humans a lot to help control cough. We can also use hydrocodone. Both codeine and hydrocodone are narcotics. Well, so is butorphanol. So it's actually more of an analgesic. That being said, though, all three of these medications, Torb, codeine, hydrocodone, they're all controlled substances. A controlled substance is a medication that has and has been determined to have a abuse potential. An abuse potential means that this medication has the potential to be abused. So I'm going to be looking at a lot of narcotics, pain medication, sedatives, tranquilizers, um, analgesics, anti-seizural drugs. Those are a lot of the medications that are in this controlled category. And again, it just means that it's any medication that can be abused. And I'm not talking about the animals abusing them. I am talking about humans abusing those medications. And yes, it does happen. That's why with controlled substances, we'll talk about it more, but controlled substances, they're monitored by the DEA. We have drug log books. Only doctors can order these medications, and they have a special DEA number. If we are scripting out these medications, we have to have the pet's owner's license number to keep track of it, and that way that gets reported to the DEA, and they can keep track of who gets these medication and make sure you're not filling them at different places. It's a whole thing, y'all. We will talk about it more, but it is very strict. With controlled substances. But that being said, they're categorized for a reason. Controlled substances, for example, fentanyl is a controlled substance. That's a very powerful narcotic. It's analgesic as well. That medication absolutely can be abused. That's why we're seeing a big problem in our country right now because it's being used illegally and people are dying. However, it still has its place in medicine. So they don't want to make it completely illegal. So they move it into the controlled category where it's not illegal, but it is much harder to get your hands on it. And doctors have to jump through a lot more hoops to even script out these medications. Um, and there's very strict protocols on how much they're allowed to script out and things like that. Um, So those medications fall into when you see this C5 or C3, that's talking about class 5 or class 3. There's five classes of controlled substances. Class 1 being the most dangerous or the highest abuse potential. Class 5 being the least dangerous, the lowest abuse potential, but still has abuse potential, which is why it's on that controlled substance list. I apologize, you guys. I don't know if you can hear that, but that's car alarm just insistently going off. Okay, we'll close that. Make it better. All right. Now, continuing with antitussives, we also have mucolytics, which help break up mucus. Mucolytics, they break up mucus, they help reduce mucus viscosity. So remember, productive cough produces mucus. This is what I would want to use for that. I want to break up that mucus. I want to reduce its viscosity. Instead of having it be this thick mucus that can't get expelled, it breaks it down, makes it not so thick, and they're able to actually produce and cough it out and get it out of their system. That's what we want. Medication that we can use for that is acetylcysteine, which is also known as mucomist. This is a nebulized saline. And if you don't know what nebulizing is, I'm going to show you that here really quick. So nebulizing, we do it in dogs and cats, but we also do it in large animals as well. And yes, I am talking about an inhaler. So we use inhalers for dogs and cats, like if they have asthma, but we also have cages and kennels. These are kind of like makeshift little boxes, but they do have cages in veterinary medicine that have a nebulizer attachment, and it basically just vaporizes the medication. So they breathe in the medication and it goes directly to their lungs. So this is really great if we're treating something like asthma, right? Directly associated with the lungs, or pneumonia. It's that's a infection in the lungs. If again, if we're treating with infections or anything like that in the lungs, it's best to treat that specific area, right? Doing a vapor where it's inhalant right to that source is going to be way more effective than taking a pill. So you will see, again, this is nebulizing like for dogs or cats. When it comes to horses or large animals, we use machines that hook onto their halters. Um, and then that little chamber in front is where we put the medication and water, and we press a button and it starts the mist, that vaporized mist, and they will start to breathe that in. And usually the treatment's about 15 minutes long. It's pretty cool, pretty handy dandy little thing right there. They're pretty expensive though. I wonder how much they're selling it for. Oh, not too bad. Only 1300, 1350. Which honestly, I was about to say like 5 grand. So I'm that's decent for what I was thinking it probably was. Yeah, no, so nebulizers are used in human medicine too. Oh, your cat, your aunt's cat. Yeah, no, definitely. Yeah, I know it's really cute when people see the cat inhalers, they're like, "No way." I'm like, "Yeah, no, yeah, absolutely. We do use them. Animals can have asthma and stuff just like us." But yeah, different varieties there, depending on what size of animal that you're treating. All right, let me just get this back to that big screen. More on medications affecting the respiratory system, we also have expectorants. So these medications increase the mucus fluidity by generating respiratory tract liquid secretions. So same thing, it's going to help break down the mucus and help with the patient being able to cough up that mucus and get it out of their system. So guaifenesin, you've probably heard of guaifenesin because that is the active ingredient in Mucinex, in Robitussin. Those are over-the-counter medications for humans. So yes, we can use guaifenesin in animals. That being said, do not go to the drugstore and buy guaifenesin like Mucinex or Robitussin and give that to your pets. Please do not do that. One, it's not dosed appropriately for them. You can absolutely kill your patient or kill your own animal by dosing them incorrectly. That's the whole kind of premise of the lecture that we're talking about in chapter 8. Also, human medicine has a lot of things added to it that aren't necessarily safe for animals. Did you know that they can be elixir type medications that include alcohol and solvents that abs or dyes and sugars that absolutely should not be consumed by an animal? So, and I'm going to be honest, it's a little debatable on whether it's safe for our consumption too, but that's a story for a different day, different class. So, again, I want to caution you, and you will see some of these medications that look familiar that you're like, oh, I've seen that from the drugstore. Please do not give your animals any human version of these medications. We make specific pet formulations of these medications that don't include all these extras and additives, and also that are at an appropriate dose for the animal. Just because it's even if you had like a large breed dog and you're like, oh, if you give that to a human, you should be able to give that to a dog. The thing is their metabolism is totally different than ours. What could be a normal dose for us could be a deadly dose for a dog or cat. Or it could be a mass underdose that has no effect at all. Every medication affects animals differently, even between dogs and cats. We can also use another expectorant is saline. So this can be given like by mouth. If you've ever seen like the nose sprays or things like that to kind of help kind of invigorate and flush out those areas. Now, we're going to talk about this for a moment here because the last bullet point on this PowerPoint says eucalyptus oil, pine oil administered by inhaled vapors. So, essential oils are really controversial in the veterinary field, really controversial. I am going to tell you my professional opinion about essential oils. I think that they're great. I love essential oils in humans. They've done a lot of testing in how to use these oils to where they are safe for us to use them for mostly topical or inhalant administration. However, there is not a lot of research out there with animals. In fact, very little, if any, at all. So, I cannot sit here and confidently tell you that it is safe to give to animals or to use on animals because the studies are not there to prove it. I will say that under the guidance of an integrative veterinarian, they will use oils for certain purposes. An integrative veterinarian is a veterinarian that does more of naturopathic medicine. I'll type it up here in the chat for anybody that's interested in looking them up. Uh, there is integrative veterinarians kind of all over. I know that there's one in Santa Ana that we work with. And integrative medicine means that they do more homeopathic, natural style medicine. So that could mean that they use Chinese herbal medicine, they use oils, they use um, uh, chiropractic care, they use cold laser therapies, they use acupuncture. So that's more of that integrative style. So these integrative veterinarians, I know, use oils. Under the guise of a veterinarian is the only place where I would do that. I would strongly encourage you against using oils on your animals unless it's strictly under a veterinarian's care. And please do not apply oils directly to your pet's skin or ingest them at all. When we, for humans, I really like essential oils. I use them a lot. I use really high quality oils. I use doTERRA. Um, so that's also really important, the type and quality of the oils that you're using. Um, and again, you're not supposed to be putting concentrated oils on your skin or really anywhere on you. It should have a barrier oil. There should be some kind of carrier, that could be castor oil, really any kind of oil that you would want to use for that, to help bind and carry that essential oil and to dilute its potency, until to a concentration that's effective for whatever we're trying to treat. So, again, it's very particular. And if you have never used oils before, you don't know what you're doing. The last thing you want to do is do it improperly. And now you're bringing your pet in because you burned them or they have a bad allergic reaction. I've seen pets uh, have really bad respiratory reactions because they put peppermint or something like right on their face, and now the animal is having an absolute meltdown. Oils can also burn. If you've never used essential oils, especially things like eucalyptus, peppermint, any of those stronger oils, absolutely can burn on application. Again, if you do not have knowledge in oils, and honestly, if you're not under the guise of a homeopathic or integrative medicine doctor, I would please refrain from using them. Again, because it needs to be diluted properly, it needs to be administered properly. I would hate to see somebody injure their animal, and I have seen people injure their pets because they want to treat more naturally and they use oils and then they end up really almost, really hurting their animal. So, that is my professional opinion about it. I'm open to using oils. I love oils in humans, but I would only want to do it under the guise of a veterinarian. I would want that direct instruction from them so that I know that I'm doing it correctly and I'm not going to harm the pet in the process. Okay, y'all, before we get into this next slide, for more drugs in the respiratory system, we are going to take a short break here. So I am going to pause the recording and we'll resume that when we come back from that break. Welcome back from the break, students. We're going to continue on with the PowerPoint for today. So we are still looking at drugs affecting the respiratory system. So the next set of drugs that we're looking at here are decongestants. So these are drugs that reduce the vascular engorgement of the mucous membranes. So when you think of being congested, right? Mucous membranes, like in your nose, super swollen. You can't breathe. It's all inflamed. So the decongestant is going to help reduce the vessels in the nose that are swollen and inflamed and engorged. It's going to reduce that. So they're going to start to shrink down and be able to breathe easier. So a very common decongestant, we use these in humans and they use it in animals, is called phenylephrine. We also use bronchodilators, which are very similar. These are medications used to relax the smooth muscles that surround the terminal bronchioles. So again, into the airways. These are usually medications that are inhalant or given by mouth. So that could be terbutaline or even albuterol. And albuterol is very common when you think of, I can tell you when I think of asthma, the first medication I think of is albuterol because that is what a person or an animal would take if they were having an asthma attack and they need the bronchioles to be dilated so they can breathe that air ASAP. Albuterol is going to give that pretty much instantaneous bronchodilator effect when given through that inhalant method. We can also give an injectable version of a bronchodilator. Aminophylline, not as common. It's obviously better to give the medication right directly to that area where we're wanting the effect to take place. Switching gears, we are now going to look at drugs affecting the endocrine system. And the endocrine system, that is a master gland system in the body. So, starting with the pituitary gland in the brain, we're going to talk about the thyroid today. We're also going to look at the adrenal glands and we're going to look at the pancreas. All three of those are glands that are a part of the endocrine system. And we're going to look at health conditions that can happen and the drugs that we use to treat those health conditions. If you've already taken Module 101 with me, which is anatomy and physiology, this is all going to be really familiar to you. We've already talked about this. Now we're just learning more about what specific medications I'm going to give. So, with that being said, the first drugs that we're looking at here are for the thyroid. Now, the thyroid, that's located centrally in the neck. And I want you to think about the thyroid like the central gland of the metabolism. It really is the metabolism of that pet. And unfortunately, with the thyroid, it can become diseased where it can either be hyper or hypo. We're going to look at that here in a moment. So we see hypothyroidism and hyperthyroidism. Hypo, if we break this down again, going back to Module 101 with that terminology, if you don't know this, you need to revisit this. If this is new to you, don't worry, you will take that module at one point. But hypo, I want you to think of it this way. It's low and slow. It's below normal, below optimal functioning levels. Hypothyroidism means the thyroid is being sluggish. It is not working up to its ability. It is underactive. If the thyroid is underactive, hypothyroidism, we commonly see that in dogs. And with hypo, if you think about it, if the metabolism is low and slow, the patient will gain weight quickly, even if they're eating the same amount of food than they were before. So we commonly see that kind of hand in hand where we see older dogs that gain a lot of weight kind of unexplainably. We do some testing. Hypothyroidism is a big factor that goes into that. So we would treat hypothyroidism with levothyroxine, a synthetic version of T4. We can also give a synthetic version of liothyronine, which is T3, but it's more commonly treated with just a levothyroxine. Now, hyperthyroidism, that's the flip side. Hyper, above normal. Think of hyper, yeah, just above, excessive. with the thyroid being hyper, that means the metabolism is on overdrive. It's going crazy. And I know that that sounds awesome, but it's not. Let's talk about it. So, if the thyroid is going off the charts, it is overactive. That means that it's burning off calories before the pet's even consumed it. We see hyperthyroidism most commonly in cats. We tend to see older cats that come into the clinic that drop a lot of weight unexpectedly and they're ravenous. I mean, they're super hungry, meowing for food all the time, bugging their owners, but they're losing weight. It's usually due to hyperthyroidism. So that means their thyroid is producing too much of the thyroid hormone. It needs to calm down. And there's a few different ways that we can do that. We can give oral medication like methimazole. It's also called tapazole. It's actually called falimazole in the field. Falimazole is a feline version of methimazole that has a fancy coating on the tablet that doesn't taste icky because methimazole, it has a terrible aftertaste. And if you think that giving pills to cats is hard, try it when the pill tastes terrible. It's even harder. So they made a feline equivalent. Again, you'll more than likely run into falimazole in the field. It's much easier to give that coated tablet. Now, that's a daily medication that we can give. It says applied topically. You can also get a transdermal version that just gets wiped onto the pinna, the inside of that ear flap. Two different methods you can give it. However, there's also another treatment for hyperthyroidism, and it's called radioactive iodine, also known as RadioCat. This injection is given intravenous, so it's an intravenous injection of iodine. And what iodine does is it will kill parts of the thyroid. It will. It'll attack and kill overactive sections of the thyroid. So what you're doing is you are partially destroying that organ so that it goes from overactive, destroy part of it, it drops down to more of a normal acting thyroid. So it's more of a permanent treatment. And it's really great. I don't think that I think that it's a great option if you can afford it. It is pretty expensive and it's not done everywhere. But it can be a better alternative if giving pills or medication every day isn't ideal, or if you just want to treat this and not have to, again, give a daily medication. The next class of drugs we're going to look at here is pancreatic drugs. So these are drugs for the pancreas. Now, the main job of the pancreas is to store glucagon and release insulin. The pancreas is what controls the blood sugar in the body. It keeps it stable. When the pancreas is not working correctly, patients can experience hypoglycemia or hyperglycemia. That's low and high blood sugars. Insulin brings the sugar back down. To bring the blood sugar up, if it's too low, the pancreas usually has stored reserves of glucagon, which is stored glucose, which is sugar. However, with the patients that is diabetic, they with their pancreas not working effectively, they might not be able to produce insulin or release glucagon, which means it's completely uncontrolled. Um, so it would then be giving insulin to bring it back down and then giving carbs like kibble, which is higher in carbohydrates, or even smearing honey on the gums of your pet to increase that blood sugar. Now, diabetes is a little different in dogs versus cats. We do use different type of insulin in dogs versus cats. Dogs, we tend to use Vetselin. Cats, we use Prozinc. Um, it also has different concentrations. Vetselin for dogs is U100, Prozinc for cats is U40. And so that has to also do with the concentration level of that insulin. So we do treat, again, it can get a little tricky treating specific species and making sure that we're using the right ones for that. But it's similar to humans where insulin for animals, we usually give it after meals, before, during meals. And one thing that I want to preface with this, just to talk about it a little bit more, because I don't think there's any other slides that talk about diabetes, is insulin is what's going to bring the blood sugar back down. It's going to be the main medication we're going to use, but it's not the same form that you're going to see with human medicine. In human medicine, if you have a family member or know somebody that's diabetic, they have these pens that they use and they screw the needle on and then they can dose it and then just press inject and press a button and it's an applicator pen. They're really great. We don't use those in animal medicine because they're really expensive. And they don't have any that are like formulated for animals, so we're just not there yet. So to give insulin, we're using vials, glass vials, and then needles and syringes to manually take it out of the bottle and then give via subcutaneous injection. To check an animal's blood sugar, it's the same as a human. You would just do a simple, you could do an ear prick or you could prick in between their paw pads to get a little drop of blood to go onto that glucometer to read their blood sugar. You do have to have a specific pet glucometer that's specific to that species of animals. Yes, they do make ones for dogs and for cats. They don't market them for animals, but we can use continuous glucose monitors on pets like the Libres. You've probably seen commercials for those. In human medicine, they like to use Dexcoms a lot, but they're really expensive. So in pets, we like to just use the less expensive brand, which is Libre. That's a sensor that can go on the patients. We shave them and it gets attached to them. We skin glue it to them. And it'll read their sugar levels for the next up to 14 days for as long as we can keep that sensor on them. So that's a great option. And it's just gonna continue to get better, but it does vary with kind of the equipment that we have. Okay, next class of drugs that we're looking at here is for the adrenal glands. So the adrenals, which are responsible for releasing a lot of your stress hormones. The adrenal glands are responsible for your fight, flight, freeze response. They keep you alive. They keep adrenaline running and released when you need it. Very important. But if exposed to too high of stress levels for too long, if overexposed to steroids, corticosteroids, absolutely can cause disease of the adrenals. So we're going to talk about that. We're going to talk about hypo versus hyper. And again, if you've already taken my module 101, this is going to be a recap. If you haven't taken it yet, don't worry, you will. And we're going to go over a ton of information about the adrenals in that module. So today we're mostly talking about the medications we can use. So for hypoadrenal again, hypo, low and slow. It's adrenals are not working, they're not producing, they are below average. So hypoadrenal, the familiar name that we use for this, it's called Addison's disease. And again, it's when they're not producing enough of those hormones and adrenal responses from the adrenal glands. So we can use, and we usually supplement because they're not producing these steroids, we will supplement then with steroids. So we'll use a mineral corticoid or a glucocorticoid or a fludrocortisone to help supplement them. That being said, as you can see, there's a lot of different types of steroids that are listed here. How would I know which one we're going to choose? Well, I'll tell you a few of the ones that are really common. Dexamethasone, hydrocortisone, methylprednisolone, prednisone, trimicolone. All of those are great. We use them all the time. How do you know which ones we're going to use and which ones we're going to use together and not? Well, remember, that's not for you to decide. That's the veterinarian. That's why they go to school for so long. It's because they're going to know those answers or they'll figure them out. So just know that we use a lot of these for treatment of Addison's disease. And they will absolutely select based off of blood work and diagnostic results which one will be best fitting for that animal. Now, on the flip side, there's hyperadrenocortism. This is when the adrenals are going off the chart. They are super stressed. Cortisol is going crazy, and it results in Cushing's. So hyperadrenocortism is just another word for Cushing's disease. So this is usually, excuse me, this is usually iatrogenic, which means it's caused by treatment or caused by medication. So Hyperadrenocortism, it's usually because we've been treating them with too much steroids. Now, I don't want you to think of, I know, again, throw those stigmas out of your head because I know that when we think of steroids, what you probably think of is humans that use steroids to build muscle and stuff like in the gym and things like that. When we're talking about steroids for animals, we use steroids to promote healing. A lot of the time, we're giving steroids to help promote healing for a pet. However, they can be on steroids long term if they have chronic health conditions. A main one is chronic skin conditions. If they've got chronic skin issues and they're on allergy shots and medications, it could be that they're also on um, steroid shots. Very common. Depomedrol is one of the most common ones that we use. Um, that being said, chronic use of corticosteroids can cause hyperadrenocortism, where they just go way too high for way too long. And it depresses the adrenal glands over time. So, what can we do? Well, we're going to stop any steroid use right away because it's usually caused by giving too much steroids. So, we're going to discontinue that. And then we can give medications like midotane, which is also known as lysodren, which causes selective necrosis of the adrenal glands. So again, the adrenals are overproducing, they're going crazy. So we can give a medication to help kind of kill off part of that organ to make the production less, similar with what we saw with the thyroid. We can also give a medication called ketoconazole. This reversibly inhibits corticosteroid development. So it'll help control that. We can also give L-deprenyl or Anapril. This can cause dopamine depletion, which can be needed. Usually, pets that are hyperadrenocortism also have way too high of dopamine levels because these stress hormones are just off the charts. So we actually need to kind of deplete it back down to help get them back to a normal level. Again, the severity absolutely plays a role in the medications they're going to choose in the route of treatment. Okay, we are going to talk about drugs affecting the reproductive system. So, we're looking at hormones here. Hormones that naturally occur in the body, but we can also give artificial versions of these hormones if needed. We give hormones to help synchronize estrous cycles, to either prevent pregnancy or to alter the uterine state. We also use hormones to get animals pregnant or to induce them for labor. We use a lot of these hormones for a lot of different purposes in reproductive medicine. Now, that being said, it is its own specialty, reproductive medicine. These are doctors that specialize in reproductive sciences, and there is space for it in large and small animal medicine. They're going to be tracking the females and tracking their estrous cycles, tracking when they're in heat, again, when they're at that time of ovulation, ready to be bred, and hopefully be able to fertilize and create embryos and have a successful breeding cycle. So that's what reproductive medicine specialists do. They track these hormones, they track these animals, and they can supplement with hormones if they're not making enough, they're at inadequate levels, or even to just supplement to make sure that the pregnancy stays. We also use, again, some of these different hormones after or during the labor process for animals to help induce labor, to help it go along. Also for afterwards. For example, retained placenta is a common, it's not necessarily dystocia, but it is a common medical occurrence that can happen after birth where the placenta does not want to come out on its own. It's retained in that uterus, and that is an emergency. It can get stuck, it can get retained, it can become necrotic, it can cause sepsis, the patient can die. So, giving something like oxytocin, a synthetic version of oxytocin, that love hormone, we see that used massively in breeding. It also, when given, will induce contractions to help expel that placenta. So, are synthetic hormones bad? No, not at all. When used appropriately, as again, I probably sound like a broken record player. When dosed and used appropriately, it has great medicinal benefits when needed. Um, so we do, again, supplement with hormones as needed for those breeding cycles to ensure, hopefully, fertilization and successful pregnancy. Okay, last subject that we're going to talk about this evening is drugs affecting the nervous system. So I'm going to talk about anesthetics, tranquilizers, sedatives, analgesics. So anesthetic medications, these are medications we use in surgery, usually to put the patient under inhalant anesthesia. That would be isoflurane, um, which is one of the older medications. We now use sevoflurane. It's kind of one of the newer on the market inhalant anesthesia drugs. Both iso and sevoflurane come in a liquid form that we put into the vaporizer. Um, that's part of our anesthetic machine that vaporizes it, and then the patient breathes it in. And that's how they keep under that anesthesia during that surgical process. Now, if you haven't taken Module 105 yet, that's our surgical module. So don't worry, I will come back to this in that module and we'll talk about that process and how they absorb the anesthesia and it goes through their body and how they exhale it and all of that. We will totally get into that, but all you need to know is that there's a lot of different drugs that go into that anesthesia process. Some of these are gases, some of these are medications to help induce them, like propofol or ketamine, barbiturates. Nitrous oxide, not used very much, but can be. We also have tranquilizers. These do not have analgesic properties. That means that they don't have pain control. All they do is help tranquilize the animal, which is essentially like a muscle relaxer. It helps calm them down. It helps them be less reactive. Um, it's essentially in the same category as you can see, there's diazepam, clonopin, uh, so Valium, I'm also talking about Xanax would be in this category. Absolutely. So is it going to knock them out? No. They're going to be coherent. However, they're going to be kind of muscle relaxy, calm, tired. It's usually what we're going to see with the tranks, but it shouldn't be knocking them out. That's not the purpose of a tranquilizer. It can be at higher doses, but usually we're using it just to kind of take the edge off. A sedative is more potent than a tranquilizer, and a sedative is what's going to knock them out. So we don't have to place an endotracheal tube and like breathe for them or anything, but it's going to knock them out. Um, and that's going to be like droperidol, but in all honesty, we tend to use sedatives that have analgesic properties. So these are sedatives that also help with pain. That's going to be xylazine. Also, dextomidine, known as dextromidor, it's going to be the most common one you're going to see with small animals. And detomidine or dermosidan is also used. Now, dextromidine or dextromidor, this middle one, you are going to see it used all the time. It's super safe. It's formulated for dogs and cats, and it has a reversal drug. So we can sedate them. And let's say we're like doing an abscess removal, right? We're flushing an abscess and or doing a wound repair. We usually just sedate for that. We don't usually put them under full anesthesia because if it's a procedure that's under 30 minutes, we're not going to put them under anesthesia. A sedation is fine for that. Sedation usually lasts up to an hour. Now, with dextromidor, it has a reversal drug. So let's say we just need to sedate them for 5, 10 minutes. We just need to take an x-ray. They're really aggressive, but we need an x-ray or something like that. We could give the dextromidor, take that x-ray, and then we can give, it's called anisetin. That's the reversal drug. We would give that to them, and then they'll wake up within minutes, like full awake, reversed from that drug. It's so awesome. Not many drugs have reversals to them. This is one that does. It's super safe. Again, you're going to see it in small animal medicine all the time. And it's great because we can wake the pets back up so that when they go home, they're not so groggy. Other sedatives, we just have to wait for it to wear off, which again, after an hour, they should be becoming coherent and waking up again, but they could still be walking around like they're drunk, like they're intoxicated, bobbing into things, not fully there. Um, and it could take hours up to 2 days to really get all those drugs out of the system. So Again, you'll see which ones are most commonly used versus not. Know that doctors can also combine these medications. So we call this a drug cocktail. So they could combine up to four of these, whether it's a sedative, a tranq, or a analgesic, and they can combine those to give a better dose, a better combination drug to a pet. Again, that's the veterinarian deciding that, and there's many factors that go into that, but you will see absolutely combination of it could be dextromethorphan with xylazine or with Valium or with buprenorphine, for example. Now, some more medications. These are analgesics. So these reduce the perception of pain only. So these are pain medications. These are my narcotics. These are my controlled substances. So that's going to be like oxymorphone, butorphanol or torb, fentanyl, Demerol, Talwin, Buprenex or buprenorphine, Edermorphine. Again, those are used for pain only. However, they can have somewhat sedative effects. Buprenorphine can absolutely have sedative effects. Same with Torb, same with fentanyl. Really, all of these can, and they usually make pets pretty tired. It's normal. So we can kind of see a combination effect there. Although they're marketed for just analgesia, they tend to give again those kind of that effect. Now, that being said, there's also neuroleptoanalgesics, which are drugs that cause CNS, that central nervous system, depression. So that means that the central nervous system is being depressed down, which is as a result of sedation or tranquilization. And when we combine them with analgesic drugs, like I was saying, we tend to do a cocktail where we mix a few from each different category. And that's based on things like what's going on with the pet, the species, the age, the breed. There's so much that goes into the doctor deciding what they want to do. However, I cannot forget anticonvulsants. Those are also part of the nervous system. So these are anticonvulsants are drugs to control seizures. So convulsions, those are seizures. Anti means to go without or against it. So we are preventing or stopping seizures, trying to control them. Now, the most common one that you're going to see given on a daily basis for animals that have seizures, so to control them on a daily basis, is going to be phenobarbital. That can be given to dogs and cats. It's an oral pill that they can take. Absolutely great. Again, if you have a pet that has a history of seizures and we're trying to control them, great daily medications. We can also give Dilantin, which is a human drug, but it can be given to animals. Diazepam, also known as Valium. This is great. It is an emergency treatment of convulsion. So if you have a pet that's coming in that's actively convulsing, if I give an injection of diazepam, they're going to stop seizing within 20 seconds. It's a very fast, effective treatment for seizures. It's going to shut down those seizures really quickly, but it's not going to prevent them from coming back. So it's going to stop it in the moment, but then we need to put them on something like phenobarbital or potassium bromide for long-term control. Again, Valium is really just for emergency treatment to help stop it in the moment. It's not something we're not going to give them oral Valium to go home with. We want to stop the seizures from starting, not just treat them as they come. We also use muscle relaxants. A common one that we use here is methylcarbamol, but many of these medications we talked about do cause the muscles to relax because we're talking about sedative type drugs, anticonvulsants, analgesics. Those are all going to have some muscle relaxant effects as well. Methylcarbamol is also used in humans, very common. Okay, this is the last slide here. So, last slide for today, slide 80. Finishing up here, the drugs affecting the nervous system. So, we also have central nervous system stimulants. These will help stimulate respirations in anesthetized animals. So, when a patient is under anesthesia, when they're receiving anesthesia, they absolutely can stop breathing. That is a concern. Yes, their heart rate can stop. It can get really low. They can stop breathing while they're under anesthesia. And it absolutely can happen as a result of a reaction to the anesthetic drugs. So we can use these stimulants to help stimulate them to breathe while they're under anesthesia. Or if we gave them a medication, like let's say we gave them anesthetics or we sedated them and now they're not breathing, a stimulant's going to cause them to start breathing again. Now, I'm not sure why, but the most obvious one is not on here. The most obvious one that I'm going to be using is epinephrine. Have you ever watched a medical TV show? For example, Grey's Anatomy has a super special place in my heart. You'll always hear them say, pass the epi or give the epi. They're talking about epinephrine. That's a central nervous system stimulant. And epinephrine will wake you right up. In fact, your adrenal glands naturally release epinephrine when you're dying or when you're in a survival instinct to keep you alive. Um, so it'll keep your heart rate beating, it'll keep your blood flowing, it's going to stimulate your respirations and your nervous system to keep you alive. Um, Again, there's other types that we can use like theobromine, doxapram, and reversal drugs. But again, it's really going to be epinephrine will be the main one that you are going to see used in surgical situations. All right, students, with that being said, we are at the end of our slides for today. So we're going to be stopping for this section, and I'll be ending the recording now.